stairwell, or we even at the entrance into the kitchen, right? What other things can we do to keep the home environment safe?
Put everything up high.
Put everything up high, especially our caustic agents. The medications we said are going to really be safety, right? Locked.
Screw your shelves into the wall.
Say it again.
Screw like the shelves into the wall.
Okay. Yeah, anchor it very, very secure. Because we say our toddlers, they walk and they gotta make sure we keep the floors and all of that clean and things like that, because the least thing that they see, right, they pick it up and what do?
Right in their mouth.
Okay, so we just want to make sure we keep a safe environment there. Have to stress that we can do that upon admission. We're admitting a pediatric patient to the hospital and just teaching mom, especially one that possibly comes in with maybe electrical burn or things like that. Later on, we're not going to scold upon admission, but we will, have discharge instructions there. And we definitely said we see this sometimes here. Motor vehicle injuries are the leading cause of death in children older than 1 year of age. Why? They're not restrained, right? Car seats. And the car seats are really based on body weight, right?
Yeah.
You can really have a 6-year-old still in a car seat based on the body weight, the number of pounds. Then they go to kind of like a booster seat, and then as they can just be ready for the seat belt. And so how do we place the car seat again?
Rear facing as appropriate.
Rear facing. A lot of people say now they have the mirrors or something that you can place, because that is a little concern of mine, that mom can visualize the infant, and not have a wreck trying to, make sure that the infant is okay and not vomiting or things like that.
Now, is the infant supposed to be in the middle or on the sides?
Pretty much in the middle. They should be in the middle. Yeah. And I don't know. I don't think that those mirrors are what come with the car seat. You have to buy that extra, right? So it's not really something that the Academy of Pediatrics say that we have to have. They feel as though that you have already assessed your baby, prior to and. Things like that. And probably if they're ill, maybe have a significant other, the husband or someone else, right, be in the back seat with them. So that's a good thing too, to have the other parent or an adult to ride in the back with the child. We said suffocation. We'll take that plastic off of our mattresses, crib mattresses, and just not have them. That's nothing that we allow them to play with, right? Because they can immediately suffocate and die. Major injury. This is the one that I've been talking about. Sometimes if the children see, like one student said, according to the book, don't, take your medicine in front of your children, at any age, because just because he's 2 and cannot communicate to you, he can still observe and see, and they mimic us a lot. And so that would look like, he looks about 2 or 3 years of age, and that looks like candy to me, right? And so he's just going to take one at a time, and he should not be able to open the bottle. Sometimes we are in a hurry, we take our medicine, don't put the top on very safely, right? Snug and tight. We place it where they can get it. But then children like him, he probably can. Some are really, really smart. They can get the chair, right? Get in the chair, they climb up, and then they get the medication. What about here? Don't need to have any frayed wires, right? Should make sure that we discard those. And make sure we cover our outlets and things like that, so we don't have any going on like that, because that's maybe 18-month-old that's just playing, right? Sitting down just playing, and they're in the oral stage, and so they put things hand to mouth, and now we got a major
Major problem.
Yeah. So cerebral trauma, head injuries. We primarily identified what causes that and what kind of problems we have from it. What do we say about the age for the falls? Toddlers, and why? Cephalocadal anatomy. Most of our injuries, our cerebral trauma, are unintentional. Do we agree? And it's kind of like it's a health risk for our children, and death in children from 1 to 19 years of age. Pretty much, we say those are unintentional injuries. So what do we can say? From falls, even the child in the tree, climbing up the tree, in the tree, falls, motor vehicle injuries, bicycle injuries, car accidents, not properly restrained, and things like that. What else can we say about any of these right here? The reasoning for it. What is the reasoning for? What's the reason for falls? We said with the toddlers is due to what? Due to the anatomy, growth and development, the unsteady motor, the gait, of the toddler, and the head is the largest part of the body, so it pulls the child down, and like we even said for the toddler, into a pail of water, and they can drown. It's just based on that. So we teach what about the bicycle injuries?
Wear their helmets.
Helmet, knee pads, elbow pads, all of that. What else?
Watch for cars, she
Watch
said.
for cars, yeah.
Pay attention to your surroundings.
Attention to your surroundings, very
Don't
good.
leave them unattended.
Yeah. We see the highest mortality rate affecting what gender? Boys. It's often as pretty much what head injuries are 0 to 14, but it pretty much affects boys more so because they're busy outside. They do a lot of bicycle riding. Not saying that they do more than girls, but they're pretty much outdoor individuals and they do a whole lot of things there. But we said with helmets, it was 85% decrease. Since we have been enforcing helmets, knee pads, elbow pads, we see a decrease in deaths and injuries by 85% and brain injury by 88%. So that's why I say, and you gotta laugh when I say that you only get one brain, but really you do, right? So we gotta protect it at all times. And it says just due to the physical characteristics like of the toddler and all of that, they're more prone to craniocerebral trauma, just due to their physical characteristics, the head being larger than the trunk and all of that. What complications can we have from some head cerebral trauma? We can have hemorrhage, we can have herniation through the brainstem, we can have infection from open injuries, tissue trauma, edema, all of that can cause things like that. What kind of signs and symptoms would a child show? Acute sign. Vomiting, pallor,
Maybe seizures.
loss of consciousness,
Sleeping,
somnolence, sleeping, listlessness.
comatose.
Bulging fontanelle.
Very good. Bulging fontanelle. Very good. What about some severe? With that bulging fontanelle, what would that kind of prelude me to what? Think of what? Increase in intracranial pressure. Very good. Bulging fontanelle. Retinal hemorrhages. May have some hemiparesis. It's one part of the body where there's some paralysis there. With that head injury too, we're going to stabilize that individual, right? We will do the jaw thrust, right? And not the chin.
What?
I'm sorry, the chin thrust and not the
Not the jaw.
Sorry.
Can you say that again?
Huh. Just where you're going to put pressure on the chin just to open up the mouth instead of the,
Instead of the jaw.
Yeah.
This was super confusing.
We're going to assess the level of consciousness, the pupils and all of that there. I didn't say that much about that. We did. Okay.
So,
So,
I'm sorry. So like with a head injury, one of the things that we can do to implement with like a top warrior, if we have to inflict a head injury, would it be to maintain their level of consciousness, or would it be to get, if they do have pressure in their head, to get the fluids out there?
all of that would be done, but that's not our job. That's the physician. We're going to assess for signs and symptoms of having the head injury and what the head injury is caused. Probably maintain proper alignment, no moving of the head, keep
neck.
the head and the neck in alignment and things like that. That's why we said which one would you do with the thrusting. And then, yes, the physician would assess for increase in intracranial pressure, and he may have to remove fluid there and things like that. We're going to get the client stable, intravenous fluids, may have to intubate. It's going to be all of that before we even deal with the intracranial pressure. That's kind of like not the priority at first.
Excuse me.
because,
Do
uh-huh.
we go by ABCs for infants and toddlers and all that?
What did you say now? We're gonna still do the everything has changed. According to the American Heart Association, CBA, according to the American Heart.
Has it changed in the book? Do you know?
Your book doesn't say that? Yeah, your book should, because I've read it, CBA.
Okay, I was asking. I haven't read
Okay.
it.
Yeah, CBA is in your book. All right, so therapeutic management, the child. Sorry. Care in the hospital, level of consciousness is number 1. And so we got to remember, by the ages, we can't assess everything, or some are not going to be communicative for us based on their age, right? So, everybody's not going to be alert, awake, and tell me the date and all this and that. It depends on the age of the child and if they can understand us. They're going to be nothing by mouth initially, because we should not want them to have anything right at that time, right? May have to have surgery. As we said, the doctor may have to remove fluid due to the increase in intracranial pressure. Just depending on the type of head injury, what's really affected and things like that. Prognosis can be pretty good overall. If the child falls and we get, the mom sees such a large area to the forehead or whatever, and she just wants to watch it for a day, but it stays swollen, and now the child start having decreasing level, that's not good. So sometimes, even if we don't just bring him to the emergency room, I might need to call, my pediatrician, and even if I'm just talking to someone who's on call, I still might need to do that. And then let them tell me, but at least I tried to do, and what else I need to do and things like that. But don't take lightly falls, injuries, or, anything to your head, ever, even yourself. Something fall very heavy on your head, or you injure your, everything is protected. We do understand, before you can directly get to the brain and the meninges and things like that. But, trauma can easily occur and cause major lifelong problems. So you don't want to, be negligent and say, oh, well, I thought. No, we don't try to assume in nursing. We just try to do our best that we can.
I know you said it's CBA, but for poison in the book it says CAB, so is that different?
Say that again.
In the book for poison it's CAB, but is that different?
With the poisoning,
Yeah.
it says circulation, airway, and breathing.
Yeah. It says beginning with the CABs. So is that just for poison, or is that?
Well, that's just for poison. Yeah.
So then it's different for
Drowning.
everything else.
Yeah,
It's pretty much, because definitely you
I
gotta
just
do.
wanted to double check.
Yeah, you gotta do things a little bit different.
depending on the
Well,
situation.
that's kind of confusing there, but okay.
Yeah.
It's not good, but okay. So frequent vital signs. Sometimes I'm checking vital signs and neuro checks every 15 minutes to every 2 hours, depending on the status of the client. Giving medications, family support, rehabilitation, and the goal is to prevent as much as possible. Near drowning, I don't think I'm gonna say much about that. We've pretty much gone over that pretty much, but we said that it's called submergent injury now. According to your textbook, that's a change from last semester, from the spring. So it's a new edition, 6th edition. So that's what we'll say, because that's probably what you will see on NCLEX, if not on your own exam. But NCLEX goes with all the changes as well. So they won't say near drowning, they're gonna say submergent injury. Everybody might not know what submergent injury is. So just be mindful of that. And so that's another thing too with the burns. I don't really like, I mean, she's not thinking that the child is good. She's not really, I'm not going to say she's not watching the child, but kids do things, And so that's why they really probably should not be in that area with us at any time. Because the simplest thing can happen. Pretty much talked about that. Emergency resuscitative efforts are at the scene. We're trying to do as much as we can. And so if we can get 911 paramedics and they're on the scene, they probably will go on to intubate and things like that. And will that make a difference? Hopefully. But it just depends on the time frame that the child was submerged, how long they were submerged underwater. So we're doing this as much as we can, It's a very, very emotional situation. And especially if you've ever, experienced this, it's very emotional. Because you already have some idea that, what you're doing, hopefully it'll help, but it just depends on the time period. The child just, you were there, the child just fell in the water, they're probably fine. I still think every child needs to be evaluated by a pediatrician. So poisoning, what do we say about poisoning? Poison control. Your book does identify different types of poisoning that can occur and different type of treatments. But right now, we really want to just focus on that. We're gonna, as the nurse, call poison control because as a licensed nurse, still you're gonna have specific orders. Even at the hospitals, believe it or not, we call poison control. A child comes in, we call poison control. We don't just kind of act immediately. We call poison control and just make sure because they really, really know how to treat any and every type of poison. So it's not even the physicians. They say, yeah, but still, let's make sure with poison control. So be mindful of that, Whether we need to induce vomiting or whether we don't do anything, Whether we need to give the charcoal or whether we do anything, For the lead poison, whether we do the chelation therapy or whether we do anything. So poison control is definitely it because everybody just really don't, and you can cause very, very harm. Because caustic agents, cleaning supplies, and things like that, you definitely do not induce vomiting, right? So things like that. You don't give them anything, in their mouth, right? Because, you don't know what the caustic agent has done. Whether it's burn a hole into the esophagus, we don't know yet. So you just got to be make sure you understand that. Pretty much talked about just gonna do that. Burns. Different degrees of burn. First degree, what type of burn is that? I know you all have had burns, so we're not. Okay, second degree.
Partial thickness.
And third degree.
Full thickness.
Fourth degree.
Full thickness and underlying tissue.
Right, very good. So toddlers, we see what? Hot water scalds, right?
Yep.
Should we see them with the in the tub? I don't really get that one, Now I can see the toddler. Well, I guess maybe they could. I don't know if they have that much body weight to flip over into the tub. I don't think so. In a pail of water, yeah. So when you get an incident like that and they come into the hospital, something else happens. Somebody, I don't know. Because who turned on the hot water, and filled the tub with hot water, and that's kind of like a key sign of possible, abuse. And someone placed the child in the hot water. Older children, flame-related burns.
Mm-hmm.
Right? And so what do we think about flame-related burns?
Fire stoves.
Fireworks. Woo! It's fun, it's great, but I'm just saying, really? Nobody has anything on. I think you almost need goggles on or something. Nobody has anything on, and they're just, everything is just everywhere. It looks, really nice. Children, everything, we like that, yeah, but do we ever think about that going right there to her right eye? To his whatever, I'm not as really thinking about the burn as opposed to causing major injury to an organ, extremity, or whatever. I'm thinking of that more so. I'm just thinking of this up here, and so, we just have to be careful. And I guess, I assume it's legal, because different types. Some areas it is, and sometimes it's not, Some people do it right in their backyard, and things just go everywhere, and people aren't conscientious of the neighbor and things like that, and I don't know if they really care. I don't know. It's just all about it, but we just need to be very, very cautious with that. So the characteristics of the burn injury, the extent of injury described as total body surface area. Use the age-related charts. I'm not going to really go over that chart. We'll just let you guys observe it, things like that. Should be familiar with that rule of 9 there somewhat, but that's not something that we're going to spend much time on. Main thing here, we might want to know the depth of the injuries, and I think you all know how to treat burns. You've had burns in med-surg, and I was told that they did a pretty good lecture on that, and you all should be well aware of how to treat.
But they told us that airway was a priority for burn.
I was gonna ask that too.
That's right. They told us airway.
Depending on the type, inhalation burn
Yeah.
it is. Inhalation burn it is.
But
Airway.
from chest up.
Yeah, from chest up, but you got to remember the type of burn that a person encounters is not going to be the airway every time. Yeah. So I don't know, have you all had your CPR recently, anybody? Because they should have implemented that with the CBA?
We had ours last
Did they
last spring.
implement that?
I think it's CAB, that's what I keep seeing in the book.
Huh?
I think it's CAB because that's what I keep seeing in the book for everything. Because I just looked up head injury too, and it says circulation, airway, breathing.
Even for burns.
That makes sense, you gotta have an airway.
Can't do breathing without an airway.
Like Carson
Right,
said.
but isn't it CAB?
I mean, I thought maybe I'll just have to look at that again, but I'm saying according to the American Heart Association, which is nationwide, what did they check you off on?
It says CAB on their website, Heart Attack.
Oh,
Because mine is CBA, and I just had mine
There's a
done.
lot of things that have been updated, but they said that, like, for us, with us being in nursing school right now, we're not, there's a lot of things in the world that's changed, but don't really apply to us.
Yeah.
According to the American Heart Association?
No, not, like, there's things that they're changing and implementing, just like blood pressures and stuff, it's now probably not on there. But we're not there yet.
but if it's in the book, then you're still supposed to, like, it's saying CAB in the
It's
book.
saying CAB in your book, but I could assume I read something that says CBA.
Yes,
Let's
go by the
book.
book.
to CAB, American Heart, CBA, yeah, okay.
Yeah.
Circulation, airway,
We have what we
and breathing.
like to know what we're supposed to do.